Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Gwen Lapham and Dr. Katharine Bradley about prevalence of cannabis use disorder and reasons for use among adults in a U.S. state where recreational cannabis use is legal. Welcome to the both of you. To begin, can you please introduce yourselves?
Sure. Hi. Thanks, Angel. I'm Gwen Lapham. I am an assistant investigator at Kaiser Permanente Washington Health Research Institute and an addiction health services researcher.
And I'm Katharine Bradley. I'm a primary care internist and senior investigator at Kaiser Permanente Washington Health Research Institute.
Thank you so much for coming to speak with us today about this really interesting paper. Cannabis use for recreational purposes and the regulation of this is a topic of great interest right now. With that context, could you tell us a bit about the background of this study and what you did?
Sure. We chose this topic, whether the prevalence of cannabis use disorder was different for patients who report cannabis use for medical reasons or non medical reasons, because of the perception that cannabis use for medical reasons is without risks. And it's important to consider the current context of cannabis legalization. 23 states have legalized recreational use of cannabis. That means that more than half of US adults now have legal access to recreational use of cannabis, with high potency products being widely available in those markets. In most states with legal recreational use, provider authorization or recommendation is not necessary for patients to use cannabis for medical reasons. And we know that many patients who use for medical reasons also use for non medical reasons. So, in this context, it's unclear whether patient medical use of cannabis, with or without non medical use, would lead to a difference in a risk of a cannabis use disorder. And so, it's important to help providers understand the risks of a cannabis use disorder among their patients.
Let me just add on that one of the issues is about 30% of people who use daily develop cannabis use disorder. And so, as people use more, there's concern about whether that's going to be more and more of a problem. And so then the question is, does it differ for those who are using for medical reasons versus non medical reasons? Just to kind of frame that.
And how do you assess cannabis use disorder for the purposes of this paper?
So, for the purposes of this paper, we did a cross sectional survey with primary care patients in our health system, and the cannabis use disorder was assessed with a gold standard measure, a diagnostic questionnaire about the symptoms of a cannabis use disorder. The questionnaire provides a scaled score of a DSM 5 cannabis use disorder severity.
And so, what did you do in this paper and what did you find?
Well, in terms of what we did a cross sectional survey among the primary care patients attending our health system. We had patients who completed a routine cannabis screen as part of integrated behavioral health care and primary care. They were randomly selected to receive a confidential survey about cannabis use. We oversampled patients who are underrepresented in racial and ethnic groups. And we also sampled patients who were not using cannabis, but we mostly oversampled patients who reported higher frequency cannabis use. So, patients in the clinical setting who reported monthly, weekly, or daily use. The sample we studied here in this study included those survey respondents who indicated cannabis use in the past 30 days. So the population based design allowed us to weight results so that they are representative of primary care patients who use cannabis.
What were some of the main findings in this study?
We found that among primary care patients who use cannabis, the prevalence of a cannabis use disorder did not vary by patient reported reasons for use. Patients could report to us whether they used for medical reasons only, non medical reasons only, or both reasons for use. So the cross sectional survey asked patients to report their reasons for cannabis use, whether for medical use only, non medical use only, or they were using for both reasons. And then patients were also asked to complete a gold standard diagnostic questionnaire about symptoms of a cannabis use disorder. This questionnaire provides a scaled score of a DSM 5 cannabis use disorder severity. And so for this study, we reported on the prevalence of those 11 symptoms, as well as the prevalence of any cannabis use disorder which includes anywhere from mild to severe cannabis use disorder, as well as the prevalence of moderate to severe cannabis use disorder. And what we found was that among primary care patients who use cannabis, the prevalence of any cannabis use disorder did not vary by patient report of reasons for use. The overall prevalence of any cannabis use disorder in our population was 21%. However, we did find that the prevalence of moderate to severe cannabis use disorder did vary by patient reported reasons for use. And this was 1.3% for patients who reported medical use only, and a little over 7% for patients who reported non medical use only or both reasons for use.
You mentioned that the prevalence of any cannabis use disorder was 21% and that moderate to severe cannabis use disorder was 6%. And these numbers seem fairly high. How does this compare with national trends or what we know of them?
I'll pop in there that remember this is people who have used cannabis in the past month, so it's not all patients, and then I'll let Gwen take over.
We know that this is actually comparable to more of what we're seeing in states with legal recreational use. States with legal recreational use are seeing increases in both cannabis use and cannabis use disorder. And so this prevalence is high, but it's actually fairly on par with what we're seeing in terms of the context of the past 10 years of legalization.
Very interesting. And not to go too much out of the scope of the study, but based off of this, what do you think are some of the public health implications of these findings?
One of the important take home messages is that cannabis use disorder is common among primary care patients who use cannabis in a state with legal cannabis use, and that patients who use for non medical reasons are most at risk for moderate to severe cannabis use disorder. And that as legalization of recreational use continues to expand across the US, the results of this study underscore the importance of asking patients about cannabis use in clinical settings.
I think the biggest thing I'd add is the fact that this is common in primary care and that we need to figure out ways to implement we have validated a single item. Gwen led the project that validated a single item screen, and we need to find ways to get that more widely used in primary care settings in states where medical and recreational use is legalized.
Definitely a very important point. What do you think are some of the next important and potentially unanswered questions in this area or that you may be conducting in the future?
Well, we know that asking patients a single validated question about past year cannabis use is feasible in primary care. We still need to explore how to best assess and document patient reasons for use in a fast paced, busy clinical setting where there's not a lot of time to add additional questions. So we really need to explore how best to do that for our providers and our patients. And patients identified in primary care settings with moderate to severe CUD are not necessarily interested in treatment right away. And so we need to explore patient centered ways to engage patients around their symptoms in order to reduce their symptom burden.
Both really important points. I really enjoyed reading this study and I just wanted to know if there were any final thoughts you had or anything that we hadn't had a chance to cover.
I think the one other thing I'll just say is that it appears that people who use medically only are actually use in a different way that probably exposes them to significantly less cannabis. And so I think that'll be one of the future areas to understand is how to measure patients' exposure to the different chemicals in cannabis in a way that's clinically useful.
Yeah, some of the results that we saw, like Kathy said, hint at results that are important about patient characteristics. For example, we did find that patients who use for medical reasons only tend to be older, female, and report topical applied use as one of the primary modes. But our sample was not powered to explore those important patient characteristics and those important ways of using by patient reported reason for use and the risk of cannabis use disorder. So it's going to be important in a future study to be able to explore those associations based on how patients present and how they're using cannabis.
Just to flesh that out a little bit. So, many patients just apply topically for pain, but others smoke or vape or dab or eat. And so it's these different modes of use that we think might be an important thing to measure in the future.
Those are some great thoughts to end on. Thank you so much to Dr. Gwen Lapham and Dr. Katharine Bradley for speaking with me today about this very interesting and very relevant topic. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.